I operate on patients the same way I'd want operated on my family. Like I tell patients, nobody wants to see me at work, but you know, when they need me, they're glad I'm there. I absolutely love what I do. I'll go the extra mile for my patients because I've been a patient myself. And you know, the disease processes I deal with are, you know, most all of them are extremely life-threatening, and I take pride in what I do. I specialize in minimally invasive procedures of the brain and spine. Specifically, stroke is one of my passions. As far as when an acute stroke happens, either a ischemic, which is blood is not getting to the brain, or hemorrhagic, where you're bleeding into the brain. The ischemic we treat sooner, which is we have to go into the brain immediately and pull the clot out to restore blood supply to the brain so the patient can recover quicker, and the results are astounding. It's my favorite part of my job, to see patients come in paralyzed, and then within minutes we can get the clot out of their brain and then see them walk out of the hospital within a day or two. It's the thing in my career. My father is a physician, my grandfather's a physician. It's the thing in my generation, from being a doctor. From when I started in medical school, there was nothing you could do about stroke, to now. The technology and the medical care has really changed dramatically, and I love what I do for a living. I wouldn't trade it for anything. The majority of stuff I do is actually elective, meaning that I see patients in clinic and see them in follow-up, because now, like I said, the imaging of the brain and spine has gotten so good, we pick up a lot of diseases, for instance, brain aneurysms. When I was in medical school, the only way you knew someone had it is if it bled. Well, now patients come into the ER with headaches or see their neurologist or primary care doctor, get an MRI or a CT of their brain, and that shows an aneurysm, and we can fix it on an outpatient basis. You know, I think there's a lot in Cleveland Clinic and Martin Health are bringing world-class care to this community, and I'm excited to be able to offer that to people in such an urgent time, especially with stroke, when you can't travel. You know, every second counts. So we'll be able to offer world-class care with stroke right away.